If you wake up with a dry mouth and lips, your body is telling you this, doctor reveals. The profound discomfort of waking each morning to a mouth so intensely dry it feels like sandpaper is a sensation far too many individuals experience, yet tragically dismiss. It's that jarring moment before you even glance at the clock, before your day truly begins, when you realize every trace of moisture has been completely sucked from your oral cavity overnight. Your tongue, typically mobile and lubricated, adheres stubbornly to the roof of your mouth, making even the simplest act of swallowing a painful, impossible task. There is absolutely nothing there to lubricate the throat, nothing to alleviate the parched, abrasive feeling. If this acutely familiar scenario resonates with you, if this description echoes your daily reality, then it is imperative that you halt whatever you are doing and lend your undivided attention to the crucial information that follows. What your family, friends, or even medical professionals may have casually labeled a minor annoyance, or worse, an unavoidable part of the aging process, is in fact neither minor nor a normal consequence of growing older. It is a significant symptom that your body is attempting to communicate with you. My name is Dr. William Lee, and my professional journey spans over 2 decades, meticulously dedicated to the intricate field of senior health. Throughout these years, I have borne witness to the insidious power of this single, seemingly innocuous symptom, chronic dry mouth, as it quietly, almost imperceptibly, begins to dismantle and destroy lives. This destruction is rarely dramatic, never sudden or overnight. Instead, it unfolds with a chilling, slow deliberation, its devastating impacts only becoming truly visible, unequivocally clear when it is tragically on the precipice of being too late for effective intervention. The extensive research unequivocally supports this assertion. A meticulous 2022 analysis, published in the esteemed Journal of the American Geriatric Society, unveiled a profoundly alarming statistic. Chronic dry mouth, a medical condition formerly known as xerostomia, exhibits a staggering 61% statistical overlap with the 4 most perilous health crises that commonly afflict adults over the age of 60. These life-threatening conditions include aspiration pneumonia, a severe lung infection, systemic infection, where pathogens spread throughout the body, progressive malnutrition, a gradual and often unnoticed decline in nutritional health, and medication toxicity, a dangerous accumulation of drugs in the body. Collectively, these conditions are responsible for hundreds of thousands of hospitalizations across this nation every single year, placing an immense burden on individuals, families, and the healthcare system. And yet, they are all intimately connected to that very sensation you may have woken up with this morning. Before I delve into the specifics of the 7 critical warning signals that your chronic dry mouth might be subtly concealing, I feel it is my duty to implore you to deeply absorb the compelling story of Margaret. Margaret's journey, her struggle, and the profound lessons learned from her experience are the precise and urgent reasons I am taking the time to create and share this vital information with you right now. I encourage you to type your age in the comments below and simply indicate whether you wake up with a dry mouth, yes or no. You will likely be utterly stunned and perhaps disheartened to observe just how many individuals currently watching this very video have never, not once, brought this significant concern to the attention of their primary care physician or any other healthcare provider. Margaret was a vibrant 71-year-old woman, a retired school teacher who had dedicated 34 years of her life to nurturing and caring for countless children from outside Columbus, Ohio. She was the quintessential caregiver, the type of woman who, having spent a lifetime devoted to the well-being of others, absolutely never wanted to impose or become a burden on anyone. So, when she began to awaken every single morning to a mouth so profoundly dry that she found it necessary to keep a glass of water on her nightstand, simply to be able to articulate a few words, she chose to remain silent. She spoke of it to no one. In her mind, she reasoned that it was simply an inevitable part of the aging process. She convinced herself that it was normal, a common discomfort that one simply endures as the years accumulate. For a grueling 18 months, Margaret's morning routine began with this exact debilitating dryness day after day. And during those 18 long months, her body, in its own silent yet powerful language, was desperately screaming for attention and help. The first subtle warning was an unexplained weight loss, just a pound here, 2 pounds there, so gradual that Margaret herself hardly noticed. It was her vigilant daughter, Linda, who eventually observed that her mother's once fitting clothes were now hanging oddly on her frame, a silent testament to a body slowly diminishing. Then came the increasing difficulty in swallowing dry foods, a seemingly minor inconvenience that pointed to a deeper issue. Soon after, Margaret found herself battling a chest infection in the spring, only to be struck by another in the fall and yet another during the subsequent winter. Each time, she received the standard course of antibiotics. Each time, she was sent home with instructions to rest. And each time, a critical question remained unasked, overlooked by the parade of healthcare professionals. Why does this woman consistently keep developing chest infections? The answer arrived with Margaret's third hospitalization, a crisis point that could have been entirely averted. One Tuesday morning, Margaret awoke with a terrifying inability to breathe. Her lips tinged a faint blue, a clear sign of oxygen deprivation. Her daughter Linda, hands trembling with fear and urgency, immediately dialed 911. Upon arrival at the hospital, Margaret's oxygen saturation registered a perilous 81%. To put this into perspective, healthy adults typically maintain oxygen saturation levels at 95% or even higher. The grim diagnosis, delivered by the pulmonologist, brought Linda's world to a chilling standstill. Severe aspiration pneumonia, a condition that had developed not over a mere matter of days, but insidiously over many months. Understanding the gravity of this diagnosis is paramount, as its implications extend directly to you. Every single night, as Margaret peacefully slept, completely unaware, microscopic bacteria from her chronically dry and unprotected mouth were being inhaled directly into her lungs. This phenomenon is scientifically termed microaspiration. It is a natural physiological occurrence that happens to everyone during sleep. However, in an individual with a healthy mouth, abundant saliva acts as a vigilant guardian, neutralizing these potentially harmful bacteria before they have the chance to travel into the delicate lung tissue. Saliva is not merely water, it is a biochemically complex fluid rich with vital immunological components, including immunoglobulin A and lysozyme, functioning effectively as your mouth's innate immune checkpoint. Margaret's mouth, however, was in a state of chronic dryness. This crucial immune checkpoint had been effectively dismantled, leaving her vulnerable. For 18 long months, insidious bacteria had been making their unchallenged way into her lungs, night after night, while she lay in seemingly peaceful, yet perilous, slumber. The consequence was 19 agonizing days spent in the intensive care unit, intubated, and left with permanent lung damage. Yet, there is an even more haunting aspect to Margaret's story, a detail that continues to resonate deeply with me. During those 19 days of her mother's critical hospitalization, Linda meticulously reviewed Margaret's extensive medical records. What she discovered was truly shocking. Margaret had been prescribed 5 different medications for a duration of 6 years, and in all that time, not a single physician had ever thoroughly reviewed how these medications might interact with one another. A crucial finding emerged. 3 of those medications, a blood pressure pill, an allergy antihistamine, and a bladder control drug, all belonged to a specific pharmacological class known as anticholinergics. These drugs are among the most aggressive and potent suppressors of saliva production in the entire arsenal of modern pharmacology. Margaret's chronic dry mouth was not merely an inconvenient side effect, it was her body's insistent alarm bell, ringing loudly and clearly for half a decade. And devastatingly, nobody had truly listened. This tragic outcome was not merely a stroke of bad luck, it was the entirely predictable consequence of a widespread, yet frequently ignored, problem affecting a significant portion of the senior population, approximately 30% of adults between 65 and 75 years old, and nearly 40% of those over 75. And it all boils down to 5 fundamental aspects that most doctors, due to time constraints or perhaps a lack of specialized focus, never clearly or adequately explain. Today, I am committed to explaining all 5 of these critical points in detail. First, the profound misconception that saliva serves merely for the mechanical act of chewing must be definitively dispelled. Saliva is in fact one of the most biochemically complex and vital fluids your body meticulously produces. It is an intricate biological cocktail, teeming with over 700 distinct proteins, powerful enzymes, and potent antimicrobial compounds, all working in concert. It functions simultaneously as your mouth's primary immune system, its first line of defense against pathogens. It acts as your digestive ignition switch, initiating the complex process of nutrient breakdown, and it serves as your throat's protective lining, guarding against irritation and infection. Its role is multifaceted and indispensable. A comprehensive 2021 UCSF study involving an enormous cohort of over 12,000 seniors revealed a startling correlation. Those individuals with medically confirmed chronic dry mouth were found to be 2.88 times more likely to be hospitalized, specifically for respiratory infections, within a 24-month period. This represents nearly triple the risk, a hidden danger silently lurking within a symptom that the vast majority of people routinely dismiss as inconsequential, often before they've even had their first cup of morning coffee. Second, the perilous reality of medication combinations is far more dangerous and complex than anyone typically informs. There are over 500 different American medications that explicitly list dry mouth as a known side effect. This extensive list includes commonly prescribed drugs such as blood pressure pills, antidepressants, antihistamines, diuretics, bladder control medications, and various sleep aids. The critical danger arises when seniors are prescribed and subsequently take 3 or more of these xerogenic, dry mouth-inducing medications simultaneously. Extensive research published in the Journal of the American Dental Association in 2023 uncovered a disturbing truth. The salivary gland suppression effect, when multiple such medications are combined, does not merely add up linearly. Instead, it multiplies exponentially. This means that taking 3 xerogenic medications does not simply cause 3 times the dryness. It can, in fact, provoke 6, 7, or even 8 times the degree of salivary gland suppression, leading to an alarmingly severe state of xerostomia. This phenomenon is clinically termed the compounding xerogenic effect, and it is an issue that is almost universally overlooked and rarely discussed during routine prescription reviews, leaving countless patients vulnerable to its devastating consequences. Third, the insidious reality that chronic dry mouth can lead directly to malnutrition, even when an individual is consuming a seemingly normal and adequate diet, is a revelation that genuinely surprises nearly every single patient I encounter and educate about this critical issue. Saliva plays a pivotal, often underestimated role in triggering your entire digestive process from its very outset. It contains essential enzymes such as amylase, which begins the crucial breakdown of carbohydrates right in the mouth. Furthermore, saliva sends vital chemical signals to your stomach, effectively preparing it to produce the necessary acids for subsequent digestion. Without the presence of adequate saliva, that crucial initial signal to the stomach goes quiet, never reaching its intended destination. Consequently, nutrients from the food you eat pass through your digestive system without being properly broken down or absorbed, rendering your meals largely ineffective in terms of providing sustenance. A significant 2022 Mayo Clinic study brought this danger into sharp focus, revealing that a staggering 44% of seniors who were diagnosed with unexplained malnutrition had clinically significant chronic dry mouth that had never once been identified as a contributing factor to their nutritional decline. This means that an individual can diligently consume 3 meals a day and yet still be slowly and subtly starving, their body deprived of the essential nutrients it desperately needs to thrive. Fourth, a chronically dry mouth acts as an ominously open door, providing a direct and unhindered pathway for dangerous bacteria to reach vital organs such as your heart, brain, and even directly enter your bloodstream. Your mouth is home to a complex and diverse ecosystem, harboring over 700 distinct species of bacteria, all living in a carefully balanced equilibrium that is meticulously regulated by the continuous flow of saliva. When the protective and regulatory presence of saliva disappears due to xerostomia, this delicate balance is catastrophically disrupted. Dangerous and opportunistic bacteria such as Streptococcus mutans, Porphyromonas gingivalis, and Fusobacterium nucleatum begin to surge and proliferate aggressively within a mere matter of weeks, rapidly overwhelming the beneficial flora. According to groundbreaking research published in Nature Reviews Microbiology in 2023, these harmful pathogens do not remain confined within the oral cavity. They exploit microscopic breaks and vulnerabilities in the gum tissue, gaining direct entry into the bloodstream. Once in the systemic circulation, these bacteria have been directly and unequivocally linked to a cascade of severe health complications, including dangerous heart valve infections, the worsening progression of existing diabetes, accelerated cognitive decline, and even life-threatening sepsis in already vulnerable senior populations. Fifth, and crucially, it is imperative to understand that chronic dry mouth is almost never an isolated phenomenon. Its presence is typically your body's intelligent, albeit subtle way of flagging something deeper, an underlying medical issue that has not yet been accurately diagnosed or adequately addressed. This recognition is fundamental to moving beyond merely treating symptoms and towards identifying root causes. And this critical understanding brings me directly to the 7 specific warning signals that I unequivocally promise to share with you. It is absolutely essential to pay extremely close attention to this particular section, as it is precisely here that many healthcare professionals, perhaps due to time constraints or a lack of specific training in this area, unfortunately fall short in their diagnostic efforts. Before I provide you with this invaluable list, I want to pose another important question. How many medications are you currently taking on a regular basis? Please take a moment to simply type that number in the comments section below, because the second powerful story I am about to recount is of critical importance, especially if that number is 3 or higher. Robert was a robust, 68-year-old retired firefighter from Atlanta, a man who had dedicated an astounding 31 years of his life to courageously walking into burning buildings, putting his life on the line for others. So, when chronic dry mouth began to wake him every morning with persistent discomfort, he did what many tough men are accustomed to doing. He stoically ignored it, dismissing it as another minor inconvenience. 2 years passed with this ongoing, unaddressed symptom. Then, the insidious tooth pain began to emerge. When his diligent dentist, Dr. Simmons, performed her routine examination and peered inside Robert's mouth, she paused, her expression shifting to one of concern before she finally spoke. The sight was alarming. 8 of Robert's teeth had been aggressively destroyed by decay in a mere 14 months. She candidly admitted that she had only witnessed such a rapid and widespread destruction of dental health in patients undergoing radiation therapy. Dr. Simmons, demonstrating exceptional diagnostic acumen, began to ask probing questions, moving beyond the obvious dental issues. She soon discovered that Robert's acid reflux medication, combined with his blood pressure diuretic, had, in fact, chemically stripped his mouth of its vital protective moisture for 2 solid years. However, the severe dental decay, as shocking as it was, turned out not to be the worst part of Robert's unfolding health crisis. Dr. Simmons, guided by her clinical intuition, took a bacterial culture from his mouth. The results that came back from the lab compelled her to immediately reach for the phone with a sense of urgent concern. Robert's oral Streptococcus mutans levels were among the highest she had ever encountered outside a hospital setting, signaling a profound imbalance in his oral Microbiome. A compelling 2023 Johns Hopkins study involving a large cohort of 8,400 men aged 65 to 75 conclusively found that elevated levels of oral Streptococcus mutans were strongly associated with a significant 34% increased risk of experiencing a major cardiac event within an 18-month timeframe. When Robert's cardiologist was informed and subsequently conducted further investigations, early arterial inflammation was detected. With swift action, Robert's medications were carefully adjusted, and his chronic dry mouth was finally appropriately treated. Today, Robert is doing well. His health trajectory significantly improved, but it is a sobering thought that he was merely 6 months away from a potentially life-threatening cardiac event. The fact that a perceptive dentist asked the right, critical question about his persistent dry mouth is the sole reason he is still here with us today. Now let us turn our attention to the 7 crucial warning signals that you must recognize. Here they are, presented with clarity and urgency. Signal 1, ammonia breath with dry mouth. If your morning breath consistently possesses a metallic or chemical odor, rather than merely being stale from sleep, this is a potential and serious warning sign of compromised kidney function. The kidneys are vital for filtering waste products, and an ammonia-like smell can indicate their struggle. It is imperative to immediately request a comprehensive kidney function panel from your doctor to assess this possibility. Signal 2, thick, ropey, or foamy saliva. This particular signal is not indicative of an absence of saliva, but rather a disturbing alteration in its quality and composition. When saliva becomes thick, ropey, or foamy, it is a strong and direct signal of a potential autoimmune condition. This pattern is frequently observed in conditions such as Sjogren's syndrome, lupus, and rheumatoid arthritis, where the body's immune system mistakenly attacks its own healthy tissues, including salivary glands. Promptly request autoimmune screening to investigate these possibilities. Signal 3, dry mouth only at night. If you experience no significant dry mouth symptoms during your waking hours, but consistently awaken with severe oral dryness in the mornings, this is a highly characteristic pattern indicative of sleep apnea. During sleep apnea episodes, your airway repeatedly collapses, forcing you to breathe through your mouth for extended periods, sometimes for hours on end, which rapidly dehydrates the oral cavity. A formal sleep study is absolutely necessary to diagnose and address this potentially serious condition. Signal 4, dry mouth plus frequent nighttime urination. This specific combination of symptoms serves as a compelling and direct warning sign of potential diabetes. High blood sugar levels characteristically pull water from every single tissue in the body, including the salivary glands, leading to dry mouth. Simultaneously, the body attempts to excrete excess sugar through increased urinary output, especially at night. It is critical to request a fasting glucose and an HbA1c test immediately to assess for diabetes. Signal 5, dry mouth, plus dry, gritty eyes. This pairing of symptoms is the classic hallmark of Sjogren's syndrome, an autoimmune disorder that affects moisture-producing glands throughout the body. It is estimated to affect approximately 1 in 70 women over the age of 60 and is dramatically underdiagnosed, often mistaken for normal aging. While Sjogren's is treatable, if left undiagnosed and unmanaged, it can progress to affect vital organs such as the kidneys, lungs, and central nervous system. Early diagnosis is key to preventing severe complications. Signal 6, dry mouth plus leg or foot cramps. This combination should immediately flag a serious electrolyte imbalance within your body. Electrolytes such as sodium, potassium, and magnesium are crucial for proper nerve and muscle function. Low levels of these vital minerals, especially if you are taking diuretics, which can deplete electrolytes, can trigger painful leg or foot cramps. An electrolyte crisis, particularly when combined with dry mouth, carries the dangerous potential to trigger cardiac arrhythmias, irregular heartbeats that can be life-threatening. You must call your doctor this week to have your electrolyte levels checked. Signal 7, dry mouth that started within 90 days of a new medication. This is your body communicating a clear and urgent message that it requires a comprehensive polypharmacy review. The 90-day window is a critical period during which the anticholinergic suppression from new medications typically reaches its full clinical threshold, leading to noticeable dry mouth symptoms. Do not simply wait for your next scheduled appointment. Proactively contact your doctor for an immediate medication review. Now that we have covered the critical warning signals, let us move on to the practical steps you can take to address this issue head-on. Here are 7 actionable steps drawn directly from my own clinical practice protocol, designed to empower you to take control of your oral and overall health. Step 1. The morning mouth assessment. Before you consume any liquids or foods in the morning, dedicate a mere 60 seconds to a mindful assessment of your mouth. Is saliva present at all? What is its consistency? Is it thin and watery or thick and viscous? Do you detect any unusual chemical or metallic smell? Can you swallow comfortably without immediately needing water? Consistently performing this daily assessment will provide invaluable objective data that your doctor will absolutely need to make an accurate diagnosis and treatment plan. Step 2. The medication audit. Take the time to meticulously write down every single medication you are currently taking, encompassing all prescribed drugs, over-the-counter remedies, and even any supplements. Then, for each item on your list, diligently check the accompanying literature or consult a reliable online resource for the words anticholinergic or xerogenic, another term for dry mouth inducing. Once you have compiled this crucial information, explicitly tell your doctor, I would like a formal polypharmacy review focused specifically on my combined anticholinergic burden. Using these precise clinical terms will fundamentally shift the conversation, ensuring your concerns are taken seriously and thoroughly investigated. Step 3. Water does not fix dry mouth. It is a common misconception that simply drinking more plain water will alleviate dry mouth. This is fundamentally incorrect. Chronic dry mouth is a glandular function problem, not merely a hydration problem. Your salivary glands require essential electrolytes, specifically sodium, potassium, and bicarbonate, to actually produce saliva. Plain water, while important for general hydration, will only further dilute these critical electrolytes, potentially worsening the problem. Instead, small, frequent sips of water throughout the day, strategically paired with electrolyte-rich foods, are significantly more effective than consuming a large glass of plain water, especially right before bedtime. Step 4. The nighttime protection plan. Implement a strategic plan to protect your mouth during sleep. First, elevate the head of your bed by 4 to 6 inches. This is best achieved using sturdy bed risers placed under the bed frame legs at the head of the bed, rather than simply stacking extra pillows, which can strain your neck. Second, run a cool mist humidifier in your bedroom, maintaining a consistent humidity level between 40% and 60%. This helps to keep the ambient air moist, reducing evaporative loss of moisture from your mouth. Third, immediately before going to sleep, use a xylitol-based dry mouth rinse. It is critically important to never use alcohol-based mouthwashes, as alcohol itself is a drying agent. Step 5. Saliva stimulation. Actively stimulate your salivary glands throughout the day. Chewing xylitol gum after meals is an excellent habit, as xylitol not only promotes saliva flow, but also helps combat harmful bacteria. Sucking on sour, sugar-free candies can also effectively activate the parotid glands, which are major producers of saliva. Furthermore, incorporate crunchy, raw vegetables with every meal. The act of chewing and the fiber content can aid in stimulating saliva production. These are clinically supported, simple, and often free or inexpensive strategies. Step 6. Your doctor conversation script. When you next speak with your doctor, use precise clinical language to articulate your concerns, as this often leads to more focused and effective medical attention. Say this exactly: Doctor, I have been experiencing chronic xerostomia that is significantly affecting my sleep quality, nutritional intake, and ability to swallow comfortably. I Would like to discuss whether my current medications are contributing to this condition and respectfully request a formal salivary gland function assessment. Clinical language undeniably yields clinical results. Step 7. The emergency red flag list. Be acutely aware of these specific combinations of symptoms as they warrant immediate and urgent medical attention. If you experience dry mouth accompanied by difficulty breathing, proceed immediately to the emergency room without delay. If you notice white patches developing in your mouth, call your doctor today. This could indicate oral candidiasis, a fungal infection. Dry mouth combined with sudden confusion or unexplained weakness necessitates a call to 911 immediately. Should you experience dry mouth alongside chest pain or a rapid heartbeat, call 911 without hesitation. Finally, dry mouth with an unexplained fever warrants a same-day visit to an urgent care facility or your doctor. Let me take a moment to quickly address what I strongly suspect many of you are currently thinking. Perhaps your doctor has previously dismissed your concerns, telling you it's just aging. Is that statement genuinely true? Unequivocally, no. Clinically significant xerostomia, or chronic dry mouth, is almost invariably caused by an underlying medication, a specific medical condition, or, quite frequently, a combination of both factors. It's just aging is not a diagnosis, it is a dismissal, a convenient way to avoid further investigation. You have every fundamental right to push past this superficial explanation and demand a thorough examination. And now, crucially, you possess the precise vocabulary and knowledge to do exactly that. Another common question I hear is, can simply drinking more water fix it? Again, the answer is no. Dry mouth is fundamentally a glandular function problem, meaning there is an issue with the salivary glands themselves rather than merely a hydration problem. You cannot effectively water your way out of a broken pump. The underlying mechanism needs to be addressed. And yes, for those who wear dentures, dry mouth remains equally dangerous, and arguably, in some respects, even more so. Without the regulating and protective action of saliva, bacteria can aggressively colonize beneath denture bases, pressing directly against your gum tissue, leading to infections and further systemic complications. You absolutely do not need to possess natural teeth to suffer the severe systemic consequences of chronic dry mouth. Now let me bring you full circle back to Margaret, because her story does not conclude tragically in the ICU. After those harrowing 19 days, she eventually returned home, undeniably weaker than she had ever been in her entire life. But her daughter, Linda, came home with a resolute plan. She meticulously documented everything, every dismissed symptom, every medication, every missed interaction between those medications. Following a thorough review, 2 of Margaret's medications were carefully adjusted, and 1 was stopped entirely. The results were profoundly encouraging. Within a mere 6 weeks, Margaret's chronic dry mouth had almost completely vanished. Within 3 months, she had regained a significant 7 of the 11 pounds she had unknowingly lost, her body finally able to absorb nutrients effectively again. Today, Margaret is thriving. She volunteers 2 afternoons a week at a local senior center, radiating renewed vitality. She now proudly hands out a laminated card that Linda thoughtfully created for her, outlining the 7 crucial signals in large, easy-to-read print. Over 200 of these cards have been given away for free, a testament to her mission, and every single time someone gratefully accepts one, Margaret imparts the same profound and cautionary message. I thought it was nothing. It almost killed me. Please, please don't make the same mistake I did. I am Dr. William Lee. I create these videos, dedicating my time and expertise, because I firmly believe that every senior citizen in this country deserves to hear the unvarnished truth about their health. A truth that their doctor, constrained by demanding schedules and 15-minute appointment slots, doesn't always have the luxury of delivering in full detail. You should never, ever have to fight simply to be heard or to have your concerns taken seriously. And most importantly, you should never have to lie in an intensive care unit bed, grappling with the agonizing question of whether one simple conversation, one single answered question about a seemingly minor morning symptom could have fundamentally altered everything, preventing a life-threatening crisis. In the comments section right now, I urge you to type just one word. Type Margaret if you wake up with chronic dry mouth and are making a commitment to take this information seriously today. Type medication if you are currently on 3 or more medications and will be proactively requesting a formal medication review from your doctor. Type doctor if you are resolved to bring this critical information and your concerns to your very next medical appointment. And please, take this information and share it with just one person over the age of 60 in your life. One single person. By doing so, you may very well be handing them a piece of knowledge, a lifeline that could genuinely change the trajectory of their health, perhaps even saving their life. Subscribe for more videos like this. Real research, real stories, real actionable steps delivered with no unnecessary fluff. Bookmark this video and return to those 7 crucial signals whenever you need a reminder or a reference. Stay informed, stay empowered. I'll see you in the next video.